Hi, my name is Marc Kielburger. I'm co-founder of Free the Children, the world's largest network of children helping children through education. And I'm here in Kenya at the Baraka Health Clinic. This is an amazing place where lives are truly transformed and saved one at a time. And I'm here with Michelle Hambly, who's in charge of the Baraka Health Clinic. She's a Canadian trained nurse, an amazing woman, and she leads the team here. So Michelle, tell us what goes on here.
Well, Jambo Sana, welcome to the Baraka Health Centre. We're so excited that we're able to have this health centre where we're able to provide preventative care for mothers and ultrasounds and antenatal care and postnatal care and take care of them through their entire pregnancy. Curative services, so curing typhoid, malaria, and so many different other illnesses that occur here in the community. We're also able to have this as our base. We're able to do outreach to so many other communities and serve thousands and thousands of community members and provide primary health care and preventative health care to those community members. So I'd love to introduce you to the rest of our medical health team. So come on over, let me introduce you to everybody. So first up here is Beverly, who is a wonderfully trained nurse here who heads up our antenatal care and works with all the mums and babies here in our health center. And next we have Edna, who heads up our pharmacy actually. So she's also a trained nurse here in Kenya. We also have another Edna, and she also helps with inputting in our patients, so making sure our patient files are filled and doing the initial triage and assessment of patients that come. And here we have Gladys, who is our wonderful lab technician who makes sure that we do all the tests for malaria, typhoid, HIV, whatever it happens to be. And then next we have Amos, who is a clinical officer here, so he helps do diagnoses and treatment. And then we also have our second clinical officer, our second doctor, who also does assessment and diagnoses. So this is our whole team. So excited to introduce you to them, and welcome to the Baraka Health Centre.
So this is an important part of the health facility. This is actually our ambulance that's able to go out to make sure that all communities are serviced, and in case there's a true emergency, we're there as first responders.
Yeah, so this is our ambulance where we're able to provide 24/7 emergency care. So community members have our clinical phone. They're able to call us anytime, and we're able to go into the community, pick them up, and either transfer them here to the Baraka Health Centre or be able to transfer them to a hospital to make sure that they're given all the care that they need. This ambulance also enables us to travel out to communities hours and hours away and provide medical treatment to communities that otherwise have none. So immunizations for children and preventative and curative treatment to thousands and thousands of community members. So we're very fortunate to have this wonderful ambulance to get through the rough terrain here. So come on down, let me introduce you. This is Ali, who's our wonderful driver who makes sure that everybody gets to the hospital safe and sound. And then come on round to the back. I'll just show you in the inside where we do have a stretcher, a sink, some basins, and all the medical equipment that we need. And this is Anthony and Beverly, a couple of our team members here who make sure that community members are treated.
This place is a very special facility. It's actually state-of-the-art as well. So what we want to do is take you on a tour, room by room, of the Baraka Health Centre.
The first room that I'm going to take you into is the reception room. So this is the first room that a patient would come into where we're able to gather health information and back health history on them and keep all of their patient files where they're seen by a qualified nurse. The next room that I'm going to take you into is the triage room. So come on up these stairs here. And the triage is where we're able to do our first initial assessment. So all the vital signs for a patient. So the heart rate, the blood pressure. So we're able to have stretchers and a defibrillator in case of a serious emergency, where we do have a special emergency entrance in case somebody is brought in with our ambulance. So let me take you on over to our next room, which is a doctor's office. So of course, after a patient's been seen and the initial assessment is done, the doctor would like to do a thorough assessment and a full assessment of what's going on. So welcome on in here, where we do have a doctor doing some work right now. But this is where he's able to really talk to the patients and really find out what's going on and hopefully come up with a proper diagnosis and see if there's any lab tests that need to be done. So now I'm going to take you to our lab. The importance of the lab is to make sure that we're giving the proper diagnoses and giving the proper prescriptions to the patients and ensuring that they don't need to go to another facility to be treated, but we're able to actually treat them right here, right within the heart of the community. I'd like to introduce you to Gladys, who's our wonderful lab technician here. She's currently using one of our microscopes. Now this microscope enables us to test for things like malaria and typhoid and different diarrheal diseases, whether it's a blood sample or a stool sample. We're able to look at it under the microscope and make sure we make the proper diagnoses. So thanks to Gladys for that. Now I'd love to introduce you to Edna, who's our pharmacist here, who heads up our pharmacy, where we're able to make sure the patient gets the right medication that they need for whatever it happens to be. So we do have child antibiotics, so in case a child has pneumonia or some type of respiratory illnesses, we're able to have antihistamines, antifungals for all the different skin and different fungal infections that do occur here within the community, and other antibiotics for adults as well. So for infections, wound infections and things like that, we're able to be fully stocked 100% of the time and make sure that if a patient needs a medication, they know they can come here to the Baraka Health Centre and get what it is that they need to make sure that they're healthy and their family's healthy.
So the cool thing about the Baraka Health Centre is actually two aspects. There's the actual treatment, which we just saw, and Michelle, tell us a little bit about the preventative aspect in terms of making sure that there's the education to hopefully prevent challenges from arising in the first place.
Well, this is one of my favorite components of the medical center. And as Marc was saying, this is where we do all the education and do a ton of prevention work with mothers and children and fathers from the early stages of childhood all the way up till their elder years. So this first room is the mother, child, and health care room. So this is where mothers and fathers can come to bring their children, where they're able to get immunizations, make sure that the children are growing and having all the nutrients that they need. Here we have a weigh scale, so we're able to put newborn babies on here and make sure that, that they're having all the nutrients they need and are weighing what they're supposed to be weighing. And also for mothers and babies to have a lot of education around what's important for their children, different nutrients that are needed in the diet, and different ways that they can developmental growth and movements that they can notice within their child as their child grows. So a wonderful, wonderful facility and room that we're able to have here at the health center. The next room that I'm going to take you over into is our antenatal room. So this room is for the moms. So when they're pregnant, whether it's the first day or the first month, they're able to come in here and get extremely quality health care during their entire pregnancy. And this machine here is our ultrasound machine, where we're able to check on fetal movements of the child during the entire 9 months that they're in their mother's womb. So we're very fortunate to have this machine here. I'm very fortunate to have this facility. The next room over there is just our initial reception area where mothers and babies are able to come for their first check-in and to fill out the patient file. And we make sure that it's separate from the other reception area, so that way children and moms are not picking up any transmittable diseases that might be occurring over in the other reception. So welcome so much to the Baraka Health Center, and karibu sana.